Before continuing with this video, please pause and review the following terms and conditions.
Hi, my name is John. I'm a respiratory therapist for Children's Hospital of Philadelphia. We're here to talk to you today about suctioning the tracheostomy tube of your child, and we're going to demonstrate that although they have mucus in their tracheostomy tube and a good cough, that sometimes they need assistance in removing that mucus from the tube, and we're going to show you how to do that today. For the purpose of this video, I'm using the Evacuate Quiet Suction, and your company or your DME company who provides your suction machine at home may have a different machine that they would be using, and they would provide you with instructions on how to operate that machine. The intended use of the suction machine is to remove secretions from an airway, and it does that by creating a negative vacuum, which is going to start with here and within the machine, transmitted up through connecting tubing into the suction catheter, which will suck the secretions out and into the collection jar. This should only be performed, and this equipment is done under prescription of a physician. Now it's time to assemble your suction machine for use. We start with our unit first, where the suction is generated, and we're going to hook up our power cord. The machine is primarily electrically powered. It needs to be plugged in. It does have two other power sources. One is a car adapter for your car, and also a internal battery which lasts up to 1 hour of continuous suction at zero vacuum. The power cord is going to hook into the side of the machine, into its power port right here. And then we will plug it into our wall outlet. On the top, you'll see that we are hooked into AC power, and also that we're charging our battery on top of the machine. If we were going to use our car adapter, we would hook into the same power port, and then we would plug into our adapter within our car. So we're going to go back to our AC power once again and plug it in, and it'll indicate that we're hooked up and our power's on. Next thing we're going to connect up is our collection jar. The collection jar is here. We have a lid, and it's going to go collect right on the top, and it's going to be sealed down. There are 3 ports on top of the suction machine. One goes to vacuum, one is going to go to patient, and the other one is for sampling. We're going to cover the sampling so we have a closed system and we get proper vacuum. It's going to fit right in the top of our suction machine. We're going to use a short piece of connecting tubing to connect the machine and the vacuum onto the collection jar on top. The next part we're going to connect up is another piece of connecting tubing, which is going to connect to patient, and it's going to go on our machine, on our collection jar, and it's going to connect to the suction catheter itself so we can now start the suction. So when it's not in use, instead of leaving it attached to this at all the time, we can disconnect here. We'll cap this and cap off this so it stays covered and cleaned at all times. So now we're ready to start suctioning the patient. The first thing we're going to do is we're going to have the suction machine on a sturdy surface, level, so no secretions get back into the tubing. The first thing we're going to do is we're going to look at and make sure we have adequate power to our machine and that it's plugged in. We make sure it's plugged into our power port, and we make sure we have our AC light, power light on, and also our charging light on. And then we can go and make sure it's plugged into the wall appropriately. The next thing we're going to do is check to make sure we have the recommended pressures for our machine for the size patients we're treating. And how we're going to do that is we're going to totally block the outlet where the patient port would go, and then we're going to turn on our machine and use our pressure adjustment, and we're going to turn it totally up to its highest pressure to make sure we get total pressure that we need. Once we get that pressure, we're going to start to adjust back to the recommended pressure for the size patient we're treating. Now it's time to clean your suction machine. Before you clean your suction machine, you always have to make sure you have a backup suction machine functioning at all times so you can clear secretions as needed. And how we're going to clean your machine, the first thing we're going to do is cleaning the suction container and emptying your suction container. That's going to need to be done cleaning once a day and also emptying it as needed and not letting secretions get more than half full in your suction container. So to empty our suction container, we're going to disconnect our tubing. We're going to carefully take our jar out so it doesn't spill. And we're going to take the jar and the contents, taking our lid off and emptying the contents in our toilet and flushing it. When cleaning our suction container, we're going to take the suction container out of the suction unit. We're going to carefully take off the lid and we're going to wash it in mild dish detergent once a day. We're going to take our suction container, which is emptied, over to our faucet and clean it with a mild dish detergent. We're going to just use our sponge and we're going to clean our suction container. And place it on a paper towel to dry. And same with our suction lid. And once again, placing it on our paper towel to dry. Next thing we're going to do is we're going to take a damp cloth with mild dish detergent and we're going to wipe down the exterior of the machine, making sure we get any kind of stains or secretions off the sides of the machine. Once our machine is clean, we want to plug it back in and reassemble our machine. We're going to plug our machine back into its power port. We're going to make sure our power lights come back on for AC power and charging. And we want to make sure our machine is plugged in and charged at all times, and that because the recharge time will be 8 to 10 hours. And once it's dry, you're going to reassemble your suction machine, making sure your float is free. You should be able to hear it go back and forth, and make sure it's not sticking or you won't get any vacuum. You're going to reassemble your suction container, making sure all your ports are covered except for your vacuum and your patient, and we're going to place it back in our machine.